I've actually gone live, so I thought I'd actually jump on. I am just got done working good old Saturday in the clinic, and then I actually decided to stay later and actually do a video, and I had to finish up some charts and look some things up. But in the back of my head, I was like, oh, maybe I'll just go live and answer any questions if anybody has any. I actually just got done shooting a video about VR being a possible treatment for amblyopia or lazy eye or eye turns. And I've been wanting to make this video for a long time, but been kind of waiting for for some FDA approved treatment that can come out, and one actually came out a little while ago called Luminopia. But I've actually had multiple people reach out to me over just the last maybe year of programs that they have made. They want me to test out. There's even programs on Steam and everything that they're trying to design to help strengthen a lazy eye. And so I've been wanting to test these out, which I haven't done. I'm actually going to hopefully get to it, but I wanted just to do a video about virtual reality actually being a legit option to treat a lazy eye or amblyopia, and because I think it's kind of a cool subject, and there's a lot of things coming down the turnpike. And so anyway, so I thought I'd jump on here. You guys can ask questions if you want, for sure. I just figured I'd just, hey, say hi to everybody since it's been a while. Oh, I'm already getting questions. Here we go. Okay, so I have a question about plucking eyelashes and if there's any information about growth I should know. Are you talking about you want to try and make your eyelashes grow more? Or are you saying, hey, I want to pluck my eyelashes to stop them from growing? Or if I pluck them, will it keep them from growing? Because to grow them, I mean, there's definitely eyelash serums. There's side effects from certain glaucoma medications, latanoprost and whatnot, that can actually help grow your eyelashes, but can possibly discolor the skin. So there are eye drops and serums that you can actually put on your eyelashes that work really well. Anyway, hey, I love your videos, man. I got a lot of knowledge and got reassured when stressed out. Thanks. Oh, man. Thank you. Thanks for saying that. I actually got an email from someone the other day that just emailed and said, hey, thanks. I have dry eyes, and I've been looking everywhere, and you did a video about scleral lenses that I did a long time ago. But I guess that prompted that person to go and ask their doctor about scleral lenses, got fit for them, and it worked really well. So it's stuff like that where this keeps, of course, messing up. I don't have this on a tripod. I have it on a cookie box. But anyway, let's see if I can get this back up. It's stuff like that keeps me going. Like it encourages me to make videos, even if hardly anybody watches it. If 100 people watch it, helps one person, I'm happy. So thanks for saying that. What is the career outlook for an optometrist? I'm a senior in high school looking to pursue this career. I'm unsure if that is the right decision. That's actually a good question, because there really is, like, the big question is there's a lot of AI. I mean, a lot of jobs are in question about that, but AI and telehealth being one. I mean, there's some places right now that you can go to get an eye exam, and it's actually a telehealth exam where you can actually get your prescription checked, and it's all from a virtual live doctor off somewhere else, probably in their basement in their pajamas or something, that's just running controls. And so there's definitely some confusion there. Now, with me, how I see it, just because I'm biased, I actually am excited for certain things, certain treatments and developments in the eye world. But the outlook, I would say, of eye care, especially an optometrist, it can be shaky depending on how you look at it. I mean, insurance rates are going down. Insurance is still crazy to deal with, but I still feel like there's so much potential and satisfaction that comes from this job, at least for me. So it's just, I still recommend it to everybody that I can. But I just want them to know that there are issues coming up, that the the layout, the land of the eye world, especially optometrists, is going to look different probably in 10 years, and so it will change. But I think if we are prepared for the change, I think it's still going to be good option. Okay, so plucking to avoid growth. So you're plucking the eyelashes to try and keep them from growing. I still think that you're probably going to have some, I don't know if like plucking them out, unless you really destroy the follicle. So you can do that with cryogenics or heat or something, unless you destroy the follicle to stop the eye from growing. Hey, I feel like I have sand in my eyes. Oh man, I'm sorry. Hold on, I missed it. I feel like I have sand in my eyes from the last 3 days. Doctor didn't find anything inside. So the sandy eyes is actually a common symptom for multiple different reasons. So you can have sand in the eyes from just being dry. When your eyes are dry and you have that constant friction and blinking, sometimes they'll either just have rough spots on the surface of the eyeball. You can get dry patches, and where the eyelid comes over that, it will feel those little microscopic open wounds and actually feel like there's something in your eye, a foreign body fluid, commonly referred to as sandy eyes. It could also, being from dry, can actually cause little microscopic rolled up balls of mucus called rheum that get in there. And when you go to bed, sometimes when you sleep, you'll collect all that rheum in the corners, and that's where you get like your sleep gunkies and your goober eyes and sleep and stuff like that. But that can actually feel like sand, especially if the oil kind of hardens up in there. So that's probably the top thing, is like to concentrate on dry eyes. I don't know if I'm guessing, did your doctors mention anything about dry eyes? Sometimes you can, and this has happened to me, a patient will say, I have sandy or feeling eyes. We'll look in there and actually the eyes look really good. And so we're like, I don't see anything. And so it can sometimes be tricky, but sometimes I'll prescribe that patient like specific teardrops, whether it's oil-based. Sometimes I'll do a steroid drop, especially if I've flipped the eyelid up and I'm seeing any irritation, redness, maybe some inflammation there. Even if it's mild, I'll put a steroid drop just to calm it down. And sometimes that does the trick. What to do about thinning cornea? Ooh. So, yeah, thinning cornea, if you're kind of relating to maybe keratoconus, where your cornea is starting to cone out, or marginal pellucid degeneration, you're getting a kind of a thinner cornea there. That is hard. The only thing that I really know of is corneal cross-linking. It's actually a procedure, collagen treatments, where it actually can strengthen the fibers of the cornea that can hopefully keep it from coning out. So if you haven't looked into that, that's probably what I would start looking into. Punctal plugs to help dry eyes. Staining between 1 and 2 eye drops every 1 hour, or every hour in one eye. Wear contacts. Thanks. That is your treatment, or your dry eye treatment regimen. Oh, the question is punctal plugs to help dry eye? Sorry. So yeah, I guess a long day here for me. So yeah, punctal plugs. I still do a lot of punctal plugs. If you don't have any inflammation or maybe like blepharitis, then I think punctal plugs are a great option. If there's a lot of inflammation, inflammatory markers, blepharitis, debris in the eyelashes, I tend to try and treat that first before I do punctal plugs, because punctal plugs can actually trap that in the eye, sometimes cause the issue worse or not really help the dry eyes. So I still do a lot of punctal plugs and find great success. Sometimes punctal plugs is like the one thing that helps people. So I have nystagmus and high astigmatism, about 4 weeks into using scleral lenses, I'm guessing. It feels like I can't focus. Is this normal, waiting for a follow-up with my eye doctor? Well, I mean, hopefully you should be able to get to the point with scleral lenses that you can focus, see clear. I mean, they should work like glasses and contact lenses. Now, there's the extra challenge that you have from, if you have dry eyes, sometimes you can get debris or film that gets on the surface of either the front of the contact or the inside of the contact, and that'll make it so you can't focus, and it's more of a contact lens or a dry eye issue, rather than your eyes or anything. And so hopefully with that follow-up, they'll be able to know if it's actually going to be, they just need to change the power of that contact lens, or if you're getting some kind of film or debris on there. Hello, doctor. Hi. Hi, everybody. Really appreciate your videos in the community. Have you ever had a patient with constant blurry eyes? How can this be diagnosed? Maybe microcorneal damage, fluorescent eye test. Yeah, so um, have multiple patients where they just have, if this is what you mean, blurry eyes, no matter what we do, like glasses, contacts, um, eye drops, dry eye treatments, and there's always either like a haze or a cloud or blurry vision. This is where it's tricky because actually just Thursday, I have a patient that we've been seeing a lot. We have best glasses. They've had cataract surgery, constantly sees a cloud, has seen a retinal specialist, anterior seg specialist, treating dry eyes, still sees like this cloud, hazy vision. Um, Me and the anterior seg specialists are kind of leaning towards that maybe that person has some maybe higher order aberrations. So in the cornea or the other media, like the gel that's in the eye, might have some aberrations that's causing like glare or light fraying that can actually cause extra blur, and that's tricky to treat. And so that's a process of elimination though, and so definitely those patients that have constant blurry vision, tricky, takes an eye doctor to constantly be testing for something new, trying something else, especially if nothing obvious is showing up. I've had patients where they have constant blurry vision, and just like we were talking about punctal plugs, we put punctal plugs in there because there's a little bit of dryness, and that actually helped her the most. And so it just really depends on the person. Sandy eye sounds like a scratched cornea. Yeah, scratched cornea. So I've had someone where they've had a weepy eye, so they've had a watery eyes, and they kept wiping their eyes to get the tears out. Came in like, wow, my eyes are feeling like sand, and they're watering a lot. And we actually kind of looked at the eyes, and there was a little micro scratches actually from the tissue from rubbing on the cornea, and so there's like little scratch corneas. That's where the sandy feeling was coming from. Was actually the tissue from wiping the eye. So definitely scratched cornea, foreign body feeling can feel like sand in the eye. That's recently commented one of your videos asking about visual snow. I've heard that it's a misunderstood condition. I'm sort of confused about it all. Yeah, visual snow. I've been wanting to do a video about this because it's interesting. Interesting. It's one of those things where I think a lot more people have it than they realize. Ever since I've been kind of like looking more into it, I'm like, oh man, maybe I actually have that. And so I'll have to find your comment. I'm sorry. I get so many comments, and if I don't keep track, I try and do like a 15-minute day comment response thing. But I'm to the point where it gets difficult. If I go 2 days without like doing that, I just fall way behind. And so I'm sorry if I don't get your comments. Um, I'll put my visual snow video up at the top of the list because I think I've had a few people actually ask me about that and comment about it, and so I think I should do a video. There's enough people that are kind of wondering. How safe is the surgery to remove floaters? So I think you're talking about a vitrectomy. So there is the procedure of a YAG laser where they can actually shoot a laser and make the floaters smaller, hoping that you won't perceive them as much. The actual surgery is a vitrectomy where they go in there and remove the gel that has the floaters in there. A lot of times they call it a floater-only vitrectomy, or FOV. They'll go in there and just remove the portion of the gel that has the floater in there. I would say up to 5, 6, 7 years ago, I was a lot more hesitant to send or refer a patient in for a vitrectomy. And then I feel like there were a lot more retinal specialists that were always like hesitant to do the surgery because there are risks involved. It seems like more recently, myself included, and retinal specialists, that I don't know if there's a lot more confidence, or maybe their risks aren't as high as what they thought, or they've kind of figured out a way to like lower the risks. But I've referred a lot more patients for vitrectomy, have had a lot more success. I've even like changed the way I educate the patient about the procedure, because I mean, this is just me learning to be a doctor. I think I was had a little bit more of a scary way of approaching or educating the patient, because I was like, hey, there's risk involved. It's really scary, blah, blah, blah. And so I just scared them away, not really meaning to, but I just, had that hesitancy in there, and I've kind of changed my ways about that. So vitrectomy, still risks involved, but I wouldn't rule it out. I would look into it for sure because the success rate can be much higher than it seems like it has been. I use Restasis 3 times a day. However, in the package insert of the drug, there's an instruction to use it twice a day. Why did my doctor recommend that I use it 3 times a day? So, Restasis is usually a twice a day drop. Now, that being said, there are medications like Cequa and VEVYE that have come out that are higher dosages of cyclosporin A or higher dosages of Restasis, like more than double dosages. Those are twice a day as well. And so your doctor might be maybe approaching it from that standpoint that, hey, let's get more of the medication in there rather than try and Cequa or VEVYE. Maybe there's not insurance coverage with it and say, hey, let's try 3 times a day, to try and make it as equal as Cequa. Now that, the logic might not fully go that way because with Cequa and VEVYE, they have kind of different mechanisms of action or carrying agents that makes the drop work a little bit differently. It's still the same medication, but that might be why. Is they're like, hey, let's try it 3 times a day and to try and mimic the other drops that are out there. Ryan Stone, what? Hey, if this is the Ryan Stone that I'm thinking of, I can't see the picture on there. So Ryan Stone, he's an eye doctor, and I taught him everything he knows. No, he actually worked at our clinic before he went off to optometry school. If this is the Ryan Stone. Now he's a bigger and better doctor than I am, so I shouldn't be talking, but anyway. Hi, Doc. Is there any prescription glasses I can't afford prescription glasses. I've been using reading glasses for everyday use. Are there any suggestions, please? So when you're looking for non-prescription glasses, are you just hoping to get like readers glasses? Then that the case, it sounds like you're already doing that. You can get over-the-counter reading glasses off Amazon if you want. But as far as getting prescription, like if you're just going to get anything that corrects for your astigmatism or nearsightedness or anything like that, I guess you can find generic ones off Amazon that might have like a -1, -2. I don't usually recommend that, but I don't know if you can find any non-prescription glasses that would correct any of that without having a prescription, if that makes sense. Question, why? When I wake up, I have one eye super dry. Please help. So, could be a couple things. Could be how you're sleeping. If you're a side sleeper, the pillow, everything can actually lift up the eyelid, dry the eyes out, or just rubbing on the pillow can actually hurt. One eye, it is common to have an improper eyelid seal. So not necessarily sleeping with your eyes open, but your eyelids don't actually seal really tight. And so then you have a little gap there that actually dries that eye out. So this actually happens to me. It's my right eye. My right eye is always the more troublemaker with dry eyes. When I wake up, my right eye is the drier eye for sure. And that's my case, is the improper eyelid seal, or my eyes kind of open a little bit. If you want to test that out, you can try, if you want a home remedy, you can try is you go get some Glad press and seal, quick and seal. Anyway, you kind of cut it out and actually tape your eyelid down. That's pretty much what you're doing. You tape it down and see how your eye feels in the morning. If you wake up and you're like, wow, it's way less dry, then yeah, that usually means that your eye is open or is drying out from being open and at night. Yeah, give it a shot. Let me know. Castor oil is good for dry eye. So a lot of studies coming out really good for, can be good for dry eye, putting on the eyelid. It's a mixed bag about putting it in your eye. So usually I kind of try and avoid telling patients to just drop castor oil right in the eye, but it is looking like it works really well if you can apply it around the eyelids. Helps the dry eyes quite a bit. Have you reviewed the drug called MyBoat? No, but I've had, or not on a video, but I've had a lot of patients that have used it. It's an excellent drop, good results, super annoying to deal with, meaning that can be expensive, with insurance, can be expensive out-of-pocket pay. Knowing that you can actually get the same type of drop overseas in the UK, and it's $20, whereas here it could be like $400 or $500. And they've actually put an embargo that you can't get the drop. So people were actually ordering it from overseas and bringing it over, and like, there we go. But now they put an embargo, so it's harder to get. Still can get it if you kind of find the right place. But I did include it in one of my videos I did about severe dry eye. MIBO has been great for especially those people that have meibomian gland dysfunction. I have found that it has helped people a lot right after they have cataract surgery, months after, if their vision's still kind of blurry, and maybe like a dry eye issue. MIBO has been kind of like a go-to for that one for some reason. So that's, I don't know, it's been my little niche that I'm kind of going gravitating towards, but it's been good. Any news about red light therapy devices for home use? So no news. It's the same kind of scenario where usually the red light therapy devices that you can get like off Amazon maybe don't have the right power usage, and so there's that fear that either you're not actually doing therapy or you might be off on the power usage, or it's not powerful enough. So usually the safer route is to do the in-office therapies. But now, I mean, there are a few devices that are in the works that you can actually order that are approved for certain therapies like that for the eyes, that you can actually get it at home, but they can be pretty expensive. And so, no, I don't think I'll have to look that up. I don't know if there's any new devices that have come out. I know there's a bunch in the works though. And so, yeah. Hi, Doc. The weather messed up my eyes. They're super dry. I can't help but scratch them. So does that mean they're itchy as well? So change in weather, super common. Man, I still have a dent in my head from. I did a video about VR, and I still have a dent in my head from it. Or maybe that's just my normal dent. I don't know. Sorry. Yeah, super common for changes in weather to dry your eyes out, especially going from summer to winter. Winter has really cold, dry air. The cold air is dry air. And then also on top of that, you get a lot of the heat blowing inside buildings, and that dries the air out as well. And so usually people have to kind of step up their dry eye treatments, whether it's artificial tears, using humidifiers in the winters, like a big one, putting their vents away, making sure the vent's not pointing at your eyes when you're driving. Yeah, it's tricky. There's a lot of people that actually come in during the winter time that have to bump up their dry eye treatments or prescribing more dry eye treatments. With my scleral contacts, maybe I'm not cleaning them properly. I've been using the Clear Care Plus every night. Yeah, it could be. If it's a coating issue, you should check to see if you have a coating called Tangible Hydropeg on there. Tangible Hydropeg kind of helps. It's a different coating of the surface that can be helpful for people with dry eyes and limiting debris and deposits on the surface of the contact. But if you use the wrong solution, it can wear off the coating. Clear Care is actually an approved solution for Tangible Hydropeg, but I do have some patients that they have found if they use it every night, it can wear the coating down. Now that is just me saying that from patient experience. I don't find that online or anything like that. So I do have some patients that I'll say maybe like go every other day, or sometimes they do the Clear Care every 3 days or something. That seems to help. And if it is a coating issue and you have Tangible Hydropeg, then there is solutions and recoating agents that you can get online. It's called like Tangible Solution or Tangible something. If you look up solutions for Tangible Hydropeg, it'll be up. It'll be on there. And that I've heard. I haven't used or seen it myself, but I've heard that it works really well. Anyway, so ask your doctor if you have Tangible Hydropeg. Sorry, trying to hurry. Well, I'm sorry, guys. Hi, doctor. I have a hordeolum external, I guess, but it's not hurt at all. Like a small round piece. Is that a chalazion? Yeah, that would be. So if you have a sty, Depends on where it is, but usually if you have a sty, like a bump on the eyelid, if there's no large amount of pain, not crazy redness, it can still be a little red, then I kind of more lean towards that it could be a chalazion. Um, but the external hordeolum, it could still be a hordeolum, especially if there's a lot of redness, maybe like some mucus that have kind of snuck out that might be maybe like a mild infection. So maybe you're in between. Um, hey, doctor, what causes floaters? I feel like over time, as I get older, I see more floaters. Yeah, so floaters, the typical vitreous floaters can be caused by a breakdown in the collagen of the vitreous. So the gel in the eye, the vitreous gel, clear gel, and sometimes the collagen fibers will break down and cause either folds or they'll glob together. And if you catch the light just right, you'll see the floaters. And so that's usually the cause. Now, over time, that vitreous also shrinks down and liquefies. It's just like a kind of a natural process that happens. And that shrinking down and liquefaction can actually cause floaters, the appearance of floaters as well. And there's a kind of a bigger floater that shows up in some people because of that shrinking down of the vitreous will cause a posterior vitreous detachment, and that can cause a big floater called a Weiss ring or lots of floaters in the vision. There, I know the next question is like, okay, how do I prevent it? Well, there's definitely some companies out there, research that are trying to figure that out. There's no big concrete thing that I can give you to prevent it, other than staying hydrated, eating healthy, and everything like that, but nothing like concrete. So I have albinism and nystagmus and had heard posture surgery about 7 weeks ago. And had head posture. Sorry, I had head posture surgery about 7 weeks ago to treat my head tilt. The stitches in one of my eyes is rubbing on my lid. How long does it take for them to dissolve? So you did have stitches on your eye? Man, I'm just really interested in this. So yeah, if they're the dissolvable stitches, depends on where the stitches are and how long they need to hold. There's different types. Like the ones on the eyeball can dissolve up to like 4 weeks. There's some stitches that will dissolve at the 2-month mark. You're at 7 weeks. I would guess it would be soon if it's dissolvable, unless they need to do the long-term ones. Thank you, doctor. I'm glad to have you. You're a good person, Dr. Turkey. Wow. Thanks for the words, and thanks for joining. I mean, that's never would have guessed I would be meeting people from Turkey on here. Okay, I've tried just about every type of eye drop on the market to combat my dry eyes. I've had limited success. The problem compounds itself during the winter months. Do you have any suggestions? Ooh, good comment, because you are not alone. A lot of patients, common thing I'll hear will say, I've tried every drop. Either they'll make it worse or they don't help, or it's like super temporary. The hard part here would be to figure out what exactly is causing your dry eyes, or what type of dry eyes you have. If it's like meibomian gland dysfunction, aqueous deficient, that might help, at least choosing an eye drop to see if which eye drop would help, whether it's like a lipid-based eye drop. I need to update my eye drop video. You just kind of reminded me of that. Yeah, so see if you can actually find the root issue to your dry eyes. My guess, statistically based, I would guess that most people have meibomian gland issues, and so you could stick with the lipid-based eye drops. But a lot of times, if you've tried every eye drop, then I would move on to some kind of dry eye treatment. If you want to watch my video about my dry eye regimen that I do like every night, the thing that actually helps me quite a bit are eyelid washes. So I actually wash my eyelid and lashes with Mybo Clean. It has Manuka honey in it. For some reason, that works like really good for me. So you could try that if you do that in the morning, because my eyes are dry, or extra dry in the winter too, and so I find if I don't do that, I have a tougher day. So try that. I mean, like an eyelid wash, like in the morning and night. Is there some ways to heal? Some ways to heal the visual snow syndrome. There are more treatments that are coming out. Therapies that are coming out. Man, what is the website? I think if you just look up visual snow syndrome, it's gonna be the top one that comes up. I was gonna include this in my video as well. Starting to lose my voice, guys. I've been talking. Oh, maybe not. Oh man, where is it? Oh gosh, Visual Snow Initiative. I think that's what it is. Is that what it is? Yeah. So look up Visual Snow Initiative, and that's going to have a lot of the resources and upcoming therapies or treatments that you can look into. I think that's it. Visual Snow Initiative.com. Oh man, my eyes have onion burn symptoms that happen more often. How to get relief? I hardly open my eyes now. So I'm guessing that you're having like the sting burn, and usually that means that the tears on the eyes have evaporated to the point that the surface of your eyes is exposed to the air. And a lot of times when you have that sting or burn, you have dry patches or open wounds that touches that air and then sends the signal off there. So, I'm trying to look into eye drops that can stabilize the tear film. So lipid-based drops. That includes Optase Advanced MGD is a good one that you can get over the counter, Amazon, Walmart. I'd try that. Big thing is you want to go to your doctor and can actually see if you actually have dry eye patches, keratitis, or anything like that on there, and see how long the tears are actually staying on the surface of your eyes. So if you can do that, that'll help you know exactly what's going on. Thank you. You're welcome. Best remedy or treatment for red eyes? That's a big can of worms because it depends on the cause of the red eyes. Meaning, like if it's allergies, you want to treat the allergies, whether it's like oral medication or eye drops or getting rid of the allergen. If it's dry eyes, knowing what exactly type of dry eye you have can help. If you want a short-term remedy, just temporary, get rid of that red. Don't go for Visine, go for Lumify. Still want to, not use it all the time, so kind of just be sparingly with it. But it depends on what is causing it. Thank you, Doc. VR has helped me with dizziness. What? Okay, you're going to have to tell me more about that. So you have dizziness in your real life? So in your day-to-day life, and then when we play VR, and then you're done with VR, then your dizziness is better? Whoa. We're gonna have to. That's awesome, because usually it's the other way around. So I want to know more about that. We were 50 watching and only 3 likes. Give is the least we can do for Dr. EyeGuy. Hey, thanks. On a Saturday. You don't have to do that, but thank you. It feels good to have like the support. You guys are awesome. How do you get rid of an eye floater? Kind of addressed this earlier. So usually it's surgery called vitrectomy or laser called a YAG laser that kind of breaks it up in smaller pieces. There are vitamin or supplementation that can reduce the symptoms of floater. I wouldn't go all the way and say get rid of the floater, but it's called Vitreous Health if you want to look that up. But yeah, the surgery is called vitrectomy. I kind of addressed it earlier in the video. Like in the video where the hand of like is. Oh yeah, right there on the top. At least it's on the top for me. I don't know. Okay, currently being fitted for contacts, starting with AccuView Oasis, but wasn't really feeling it with those. Waiting for some new trials for Alcon 30, Total 30 Astigmatism. What is the opinion on Total 30? So It's been awesome. Total 30 astigmatism lenses, super stable. They're the edges are a little thicker than the Oasis, but I feel like they're more stable, and the initial comfort has been better with the Total 30. Now, you with Total 30, this is usually what I tell people. You want to test it out because it's a monthly contact. I would test it out for that good solid like 2, 3, 4 weeks. See what it feels like on the third and fourth week. There are some people that start noticing, hey, this contact doesn't feel as good anymore, and so that's the only thing. I've had a lot of people love the Total 30 astigmatism contacts. Those are the only issues, is just like try and test it on the third and fourth week. First week and second week, you can feel really good, and then you'll buy your supply of contacts, and then you're like, oh, shoot. What is your experience with Accutane-induced MGD dry eye? Is IPL the way to treat it? And if so, how long does it usually take to improve symptoms? So Accutane, the part that stinks there is it can actually destroy the meibomian glands. So I've seen some people where their oil glands have atrophied quite a bit. So now IPL is good for inflammation, helping those meibomian glands function. I wouldn't go as far as saying like get those meibomian glands back. The ones that have atrophied is trying to get them back. It does happen, but I think it's more rare. But IPL is good. It has been a good result for people that have dry eyes, MGD from Accutane. And so I would definitely look into it. I think it actually will help, but I wouldn't go in there thinking, hey, this is going to give me my meibomian glands back. So that's, I wouldn't go that far. My eyes feel super tired at work. Focusing on the screen is super exhausting. My eyes aren't red at all. Could overly sensitive cornea nerves be an issue here? It could. Usually you have a little bit of pain or that type of sensation, sting, burn with that. Or related to it is if you have some trigeminal nerve innervation. So, and that can come from corneal nerve sensitivity. It can come from eye posture. So if you're having to use a lot of muscle power to bring the eyes in, looking at the computer screen, and actually can innervate the trigeminal nerve, that can cause a lot of that tired feeling. So I would look into that. Like, an example would be you could look into computer glasses that have prism to help with eye posture, neural lenses. That's where I'd probably start, especially if your eyes aren't dry. It could be, or are they dry? They're not red at all. You could try using periodic eye drops to see if it's like more of a tired feeling from dry eyes. That's a possibility for sure. Hi, my right eye is watery, and I did everything like my best, but bothering me a lot. Watering eye is also one of those things that it can be tricky to treat. Can be from allergies, especially if it's both eyes. Big one is dryness. So if you are trying to treat your dry eyes, like whether you're trying to do like eye drops or anything like that, it could be just from your punctal plug, top or bottom, just not being able to drain the tears off. In that case, you'll have to kind of get them irrigated or opened up. So that's a possibility. Do glasses make your eyes worse over time? So the general answer is no. But when people ask me that question, I always want to say, now if we're talking about children, kids, eyes developing, there's much more emphasis and careful prescribing tactics that are being implemented now. Meaning, if we are finding a kid that has nearsightedness or myopia, we're being much more careful to monitor it closely, not over-prescribe glasses, meaning over-minus them, or even to the point where we are doing special treatments, like whether it's contacts or bifocal glasses or certain treatments that can help slow down the progression of myopia. Whereas if we just gave them glasses to correct their nearsightedness, which would help their vision, it's possible they could still progress pretty fast. And so that's the only caveat there, is you just got to be careful in children. But if you're like 40 years old and you get glasses, the question is, okay, if I get glasses, it's going to make my eyes worse. The answer is no on that one. You're live. Your scleral lens insertion videos helped me so much when I first got my lenses. I had no luck putting them in at the office or alone until I saw your content. Thanks, Doc. See, thank you for that comment. I love comments like that. Keeps me motivated. I mean, yeah, I did that video like 3 years ago, and so that's the power of YouTube. Is if I just do a video that I know could help one person, I leave it up there. Who knows when someone might come and see it and it will help. What causes eyelid twitching? So the big eyelid twitch, most common one is called myokymia. So you'll have either top eyelid, I think that's the most common one, and bottom eyelid can twitch. Usually the big factors there are stress, caffeine, lack of sleep, nutrition issues, sometimes like eye strain. Those are like the big ones. So to remedy it is usually lower your stress if you can do that, get more sleep, reduce your caffeine intake, possibly vitamin supplementation or working on your diet. I will sometimes, for those people that have the eyelid twitch for months, I usually have them try tonic water. It has quinine in it. You don't want to overdo it, but maybe like drink a glass or two today. It's super nasty. You can mix it with something though. And the quinine higher doses of quinine has been used as a muscle relaxant. But you just don't want to go overboard because they can show like higher doses. I mean, you have to drink a lot of that tonic water to have issues, but maybe 1-2 little glasses, a day, a couple days, see if that helps. Recently got an eye scratch. Doctor suggested natamycin ophthalmic suspension to use every hour. Is that important to do at the same type of sleep also? Now, if it's an ointment, I mean, I guess it depends on how bad the scratch is. If there's actually an infection, there's a risk of, getting deep into the cornea and causing scarring issues, then yeah, you want to be pretty diligent about the antibiotic. I'd follow your doctor's instructions for sure, because they'll know your eye. But I know a lot of times with eye scratches, they'll heal up really fast. A lot of times you can actually put the ointment in before you go to sleep, and do fine. But if they said overnight, then I would follow that, because it depends on the person. Hi. Watch out for antifreeze in eye drops. Yeah, eye drops will sometimes have one of the same chemicals that's found in antifreeze. But you can look more into that. It's not like putting antifreeze in your eye. Hey, how come recently I've been getting migraine aura? Ooh, I've actually had like 3 people tell me that this week. Their visual auras have been more prevalent recently. Number of issues could be weather related. I've kind of mentioned that. Could be hormone related, hormone changes due to weather or activity change. Hard to say. Oh man, we're at 43 minutes. Time flies on here. I'm sorry. Okay. VR are bad for eyes? If the question is VR bad for eyes? That is a big question these days. It's a fairly new technology, so there really isn't much to say whether there's like, oh yeah, it's bad for your eyes. There are some issues that people can have in VR. There's the accommodate divergence conflict. So because VR has a set focal point and your eyes are supposed to work together with your focusing muscle, VR kind of separates those two issues, and so people can have a lot of strain. Now, is there permanent vision issues with that? No, usually people's vision can snap back. You might get a headache, but as far as like causing permanent vision damage, no. Blue light, no. Mixed bag there, but usually you shouldn't have to worry about the blue light issue. Is it going to cause your vision to get worse, like your myopia, your nearsightedness, farsightedness? There isn't a research or anything that shows that's going to worsen there. There are some studies that show that maybe there could be some potential to slow down the progression of nearsightedness by doing VR. I actually did a video about that. I'm hoping there's more research that comes out on that, because that was super interesting to read about. So is it bad for your eyes? in a way, as far as like dryness can hurt more, can cause headaches, eye strain. Is it bad for your eyes as far as causing vision changes and stuff like that? That's a no, but the dry eyes and stuff like that is a yes. Hey, how come recently I've been getting migraine? What the, did I must have skipped over your VR one. Sorry about that. Is it risky for a severe myopia case to have a surgery to remove floaters? Um, is it risky for a severe myopia case to have a surgery to remove floaters? Yeah. So the risk there is for a retinal detachment. So that's one of the risks with a vitrectomy. When they go in there and actually remove the vitreous, they will either remove the whole vitreous, that'd be a complete vitrectomy. Might not do that, but the vitreous will peel away from the retina, so they have to separate it if it's not already separated, and that separation technique could pull and rip and tear the retina. And when you're severely myopic, your eye is longer and the retina is stretched out more, and so you're at more risk of ripping or tearing. And so yeah, there's a higher risk there for sure. I've done LASIK. Can I wear VR? Yes, you can for sure. Maybe look, just watch your eyes from getting dry. Usually people after they have LASIK, their eyes are more dry, especially if you're in VR staring at the image. But you can play. It's not going to cause cause your vision to get worse or anything like that, at least that we know of so far. How to get rid of middle age vision decline. So I'm thinking you're meaning if you need like reading glasses, the close-up vision, needing bifocal, stuff like that. Nothing that we know of to get rid of it, to like fully or prevent it from declining. Nothing concrete. I'm sorry. There's eye drops that are coming out, which is making it easier to function with it. But yeah, it's called presbyopia. You can look up presbyopia eye drops. I think there's like 4 of them, 3 or 4 of them that are either out now or being developed, but it doesn't really slow the decline down that I know of. I've tried everything for blepharitis, but I still get constant mucus. This is a hard one. I'm assuming that you've tried eyelid wipes, eyelid wash multiple times a day, or like warm compresses, stuff like that. Have you been examined for maybe Demodex blepharitis? Maybe it's more of a mite issue. Then you can start looking into specific wipes that have either tea tree oil or Extembi, the eye drop. I've had some patients that have done well with that have blepharitis for years, and then we put them on that and it worked. I don't know, that's what I'd maybe say look into. I like some advice about ocular rosacea apart from hot compresses. Yeah, warm compresses with ocular rosacea can actually, sometimes it's not good because the heat can inflame the rosacea, because it's inflammation, and can actually be not good. So sometimes people do better with cold compresses. Now, ocular rosacea, if you have access to it, look into IPL. I know it's a more expensive treatment, but it can be awesome with rosacea and ocular rosacea. Gets rid of those tiny blood vessels, helps with inflammation, gets rid of the axis of inflammation from those blood vessels to the oil glands. It's like a big one. So yeah, looking at that. Sorry guys, I have to leave in like 2 minutes. I've got a date with the wife tonight, and so I gotta leave here in a second here. My dry eye stopped when I stopped eating grains. Whoa. My dry eye stopped when I started eating healthy breads and oats, the proteins and organic glyphosate irritants were destroying my eyes. 4 eye doctors said, nah, it's not food, but it was. So I am fully on board with this. So with dry eyes, I fully agree with this. I'm more and more each day, I'm more and more convinced that dry eyes, for a good chunk of the people out there, it can be diet related. The hard part, I guess, is figuring out exactly like what in the diet is messing with it. Whether it's like certain foods that are causing more inflammation, or like in this case. So actually, thanks for sharing. I agree, can definitely be diet related. 4 eye doctors said no, huh? See, now I'm like weird. Oh, maybe I'm like the wrong eye doctor. I don't know. My eye floater eventually went away by itself. Yeah, so with eye floaters, um, it's common. I mean, I know people that have floaters and notice them all the time hate hearing that, but it is common that if you get floaters, then a lot of times they can be not noticeable to the point where people don't even notice them anymore, or they can kind of float away out of their vision, and so it's kind of nice. But some people will fight you on that one. Is it risky for a severe myopia cause of surgery to remove floaters? Yeah, I think I answered that one. What would you recommend for soaking the total 30s in? Opti-Free or Clear Care Plus? Either one. Clear Care, if you want extra clean, or if you have allergies or issues with deposits on there, Clear Care is nice. Eggs. Eggs can cause you dry eye, maybe? Is that what you're talking about? Or Demodex mite eggs? I don't know. And also, if the total 30 doesn't work out for me, what recommendation do you have for someone with mild dry eyes trying to avoid dailies? Oh, that's tricky because so many people are so different. I've had some people that love total 30 and then hate Oasis, and then vice versa. If you're trying to avoid dailies, you're going to have the Precision 7-day. That's a 1-week lens that's coming out. I'm expecting that to be good. Obviously, I haven't tried it yet. Classic one is Biofinity. It's been out for years. It's a thicker lens, more durable, but it's more breathable than most of the contacts other than a daily Total 1. It's the most breathable lens, and I've had some people that have done really well with that as far as like dry eyes. But again, you could try it and you might hate it bad, so it really depends. Ultra is another good monthly one. So yeah. Had macular degeneration surgery, need a cataract surgery. What lens do you recommend? Also have a bad astigmatism. So with the lens there, yeah, you're talking about the lens implant that they'll put in there after cataract surgery. If you're meaning, as far as, do I recommend a single vision, toric lens, multifocal lens? So I'm sure they're going to, obviously follow your doctor's instructions. Usually people with macular degeneration, we avoid the multifocal lenses. With bad astigmatism, you could look into the toric lenses for sure, but that'd be my guess, is probably a toric IOL. I hope that's what your question was. Is it risky for a severe myopia case to answer that? I have dry eye. The worst overnight. I wake up and my eyes are gritty. Why is it so bad? I try to sleep with cornea care eye mask for relief. So at nighttime, your tear production drops way down. You're not blinking, so you get the stagnant oils that solidify, become crust, and build up in the eye. And then, like I said before, you could be sleeping with your eyes open. Now, if you're sleeping with the mask on there, that should help. What if you're still getting like that mask like pulling up the eyelid? So this happens to me. If I have a mask that actually touches my eyelid while I'm moving around at night, I'll like kind of move it and actually lift my eyelid up, and that doesn't really help that much. If you can get the eyelid seal goggles, so it seals around but it has the clear shield on there, that works better for me. Or you can try this sealing the eyelid tape with like Glad Press and Seal. Sorry, I'm trying to hurry, guys. Oh man, I am way behind. I'm gonna have to go. What is the difference between ocular hypertension and glaucoma? Me and my PCP doctor keep going back and forth about the issue. So, ocular hypertension, a person can have high eye pressure. So we're talking 21 or higher. Let's give this example. So someone comes in and they have eye pressure of 25. That person can just have eye pressures of 25, which is considered high ocular hypertension, and not have glaucoma, meaning the eye pressure is not doing any damage to the nerve, it's not causing any issues, and they just have high eye pressure, and we just watch it. Now, another person comes in, and that person has eye pressures of 12, which is considered low, really good, and that person can still have glaucoma. It's called normal tension glaucoma or low tension glaucoma, where their pressures, they're still getting damage to the nerve, and so they need glaucoma treatment. And so that's usually when you're saying ocular hypertension, you're like, this person has ocular hypertension. That person has high eye pressure, but usually doesn't have glaucoma, or the eye pressure hasn't caused glaucoma yet. If you say this person has glaucoma, your instinct is to go, oh, that person has high eye pressure, but, and that's usually the case, and you're treating the eye pressure, but that person could have normal pressure and still have glaucoma. I hope that helps. Thanks, Doc. Is there any cure or surgery for retina detachment? Oh, yeah. So if you have retinal detachment, I mean, there's definitely surgeries, laser, scleral buckles, oil bubbles that they can put in there to push the retina back on there. Yeah, so there's treatments, repairs, I should say. Hello, hope you're doing well. I have PVD in right eye and developed the same in my left eye shortly after having either food poisoning or stomach virus with severe vomiting, where floaters fade. Man, yeah, sorry to hear that. Yeah, it's probably that like strain from the floaters or from the vomiting. Man, it's possible if it's recent, if it recently happened. Yeah, you can either the floaters, the vitreous will fade, or you'll become more. You'll notice them less. And I've seen this tons of times where patient will get a new PVD with a floater, one or both eyes, and everything checks out. We monitor them, and then we see them a year later, and they'll come in for their normal exam, and I'll come in their room, and I was like, ooh, how's the floater doing? And I hear this all the time. The person will go like, oh, yeah, I don't really notice it, and they'll start looking for it, and like, I think maybe I see it every once in a while, but they like forgot about it. And then I'll do a picture, and it's still there. Like the floater's still there, looks really similar to last year. So meaning that like that person kind of just got used to the floater. So that happens all the time. So that's what you want to hope for. And I hope that happens. Just kind of cross your fingers on that one. What medicine do you recommend for eye health, especially for severe myopia? So no medicine, supplementation, and keeping the eyes healthy, or diet. I mean, you're looking at either you can target the macula, so that's with lutein's a big one, zeaxanthin, mesozeaxanthin. Those are carotenoids, so vitamins that you can actually find in vegetables. It kind of gives vegetables their color. Omega-3s are big for kind of keeping the oil glands. But as far as like myopia specifically, I would target the retina the retina supplements, that can target the macula, like lutein. But I'm not saying that's going to help keep you from getting more nearsighted. It's just to kind of keep the retina healthy. Best dry eye drops. I need to update my video. I like a lot of them. Patients that I'm finding that's helping them the most. Optase, specifically Optase Advanced MGD, for a person with meibomian gland dysfunction. It's a preservative-free drop, super nice, and they have other types. So Optase has been awesome. Avizia has been really good. Avizia is a weird one where I've tried it and I don't really like it on my eyes, but my patients love it. So I still recommend it. That's an awesome one. And then there's like your classic ones like Refresh Relieva, Sustain Complete, Refresh Digital. Those have been really good. And these are just like classic over-the-counter ones that you can get like anywhere. Thank you for your work on the channel. I have dry eyes due to pulmonary sarcoidosis and now have a VR headset. Your reviews are extremely useful. Awesome. Yeah, that's so. I was talking about this with another doctor that some of my videos are like really niche specific. Someone that's doing VR and has dry eyes. So I've kind of like limited myself there. So I'm glad that some of those videos are kind of helpful. How long does LASIK last? Depends on the person. I've seen a patient where it's been 20 years and they're still going strong. I've seen a patient that's been 1 year and they got some nearsightedness back. So it depends. Oh, my eyesight get worse. I gotta go, guys. Oh my gosh. Guys, I missed a lot of your questions. Hey, if you can like keep these questions or maybe retype the questions in the comments or something, I'll get to it. I was thinking about like deleting this video because it's just like a, hey, I'm doing charts, let's do a video, but I'm feeling bad. I'm feeling bad that I'm not answering a lot of these questions here. Like autologous serum eye drops, we're actually looking into getting that specifically for our office. Usually it's a eye drop that you can make from your blood. Does really well. Usually it's kind of like a, you've tried all these other dry eye treatments and not finding any help. I'll try and do a video about it. And then thank you, eye doctor, because I have high pressure. Specialist prescribed me latanoprost eye drops, but my PCP says that, why am I taking eye drops? Prescribed for glaucoma. He just doesn't understand. Yeah, so if your eye doctor, like for with ocular hypertension, I mean, if you start getting closer to 30, 35, you might not see any signs of glaucoma in the nerve, but when the pressure's high enough, you're like, man, I could just pretty much, I'm guessing, I'm predicting the future that this is high enough it will. And so I'm guessing maybe they're like, let's just to be safe, let's do the drops. That's my guess. I have amblyopia. I saw an eye doctor over 10 years ago. He made it seemed that this is something that would have been corrected at a very young age. Has surgery moved forward since then? Yeah, no. So kind of still the same thing, unfortunately, where amblyopia develops during the developmental years. We're talking like under 12, 14 years old, where you have one eye that doesn't get the proper development from the brain. So it becomes your weaker eye, then you have a stronger eye. Later in life, even with glasses, that eye still is your weaker eye. You can try therapies and treatments and might have like minimal improvement, but it's always your weaker eye. That's still the case. Like so far there's not a surgery, and the reason why is because it's like more of a brain connection to the eye issue, not necessarily your eye. We can help correct we can do LASIK and correct your nearsightedness, and so you don't have any glasses correction in that eye, but it could still be blurry because it didn't develop the connection from the eye to the brain. And so that's what stinks. There's no like surgery to help with that right now. Oh man. The more I use drops, the more I dry out. You're not alone on that one. Can you go blind from bad MGD? Overall answer is no. Your dry eyes would have to be like really bad to the point where it's causing so much keratitis and scarring on the cornea that it can't repair itself. I mean, you're pretty much in the category of neurotrophic keratitis and cornea neuralgia. I mean, that's bad. Usually, it's not just from MGD. It'd have to pass like a bunch of different levels with combinations of different dry eyes. Yeah. Okay. Thanks, everybody. Oh man, go see your wife. Thank you for the stream. I'm going. Thank you. Okay, leave your comments in there. Let's see if I can figure out how to end this live. Do I just push the X button? Oh man, now, oh, here it's coming out. Newbie. Okay. See ya.